No, it is so exciting to be here with you all. It's wonderful to meet you and to be able to work again with the Denver Rescue Mission. I just remember your staff and your team and some of the work that we did previously, so it's an honor to
Yeah.
be back.
Yeah, well, thank you. And, for people that might be watching now or will see this later, why don't you share a little bit about Inner City Health?
Absolutely. Inner City Health is an organization that's been around for about 42 years. We started on the east side of Denver with two doctors and 4 individuals, but two doctors specifically who just felt a calling to make sure that individuals who otherwise wouldn't have access to healthcare were able to do so. They actually started in the basement, of a house.
Really?
This small practice where they'd find individuals who would need healthcare and maybe wouldn't be able to pay for it, but maybe they wouldn't be able to pay for it financially with resources, but they could pay with there was like a story about a chicken. It's a true story. It's really some kind of barter system or exchange. But the point was, rather than being compassionate by proxy, these doctors who had private practices decided to give that up and come into community and make sure that individuals would be able to have access to healthcare. And we've been on that same mission ever since. And so we have a location 38th in York, and then we also have a location in Wheat Ridge, and we provide healthcare to the uninsured and underinsured, medical, dental, and behavioral health.
Yeah. And, I think that's so important, especially when we think about the populations that we serve at Denver Rescue Mission, people experiencing homelessness. And what do you see around health and access to health care, particularly for those experiencing homelessness? It's just so difficult, right? It's difficult for people to access health care when they don't know where their next meal is coming from or even to care for themselves.
No, for sure. I mean, it's the thing that's most heartbreaking when we think about homelessness, and again having been able to serve in different capacities with Denver Rescue Mission and just in this field and in this area of love in terms of serving people. Well, most people don't understand there's obviously visible homelessness, but then there's individuals who you see sleeping in cars. There's people who have any number of experiences with this journey, and one of the primary causes for being homeless is financial crisis, and one of the number one reasons for financial crisis is healthcare expenses.
Yes,
that's the number one driver for bankruptcy. And so the cost of healthcare and housing security are linked, unfortunately. And so that's what we begin to see is without affordable health care, you have people who don't access it when they need it. And by the time that they do, you're talking about something that is not only a health crisis, but is also a financial crisis.
Yeah, exactly. And, several months ago, I had a minor health scare, but it ended me up in the emergency room for, about 5 or 6 hours.
Goodness.
And, when that bill came, I looked at the bill and I said to my wife, thank God we have insurance.
No, for sure.
And what would we do if we didn't have insurance? Yeah. And, I love what you said about medical bankruptcy. Healthcare bankruptcy is one of the leading reasons why people get into homelessness. What should we do as a community to, stand up and say, this isn't right. We have to do something different.
That is such a good question. Incidentally, I'm thankful that you're well and that you're feeling better.
Thank you.
And very grateful, for that, and we'll definitely keep you in my prayers and be grateful for that. But in terms of what we do, we are at a critical juncture, very critical intersection. Not only within our city and our state, but our nation, concerning, healthcare. And so what we do is frankly have to hold the line, concerning healthcare and access to healthcare. What we're seeing and what we're experiencing is frankly, there's a greater risk for more and more people to become uninsured.
Right.
More and more individuals to, even if they do qualify, for the healthcare benefit, be it Medicaid or otherwise, there's so many different barriers through qualification, paperwork, and things of that nature that are being enforced. And what that often results in is people who should be able to and could be able to receive benefits not, because of the headache with paperwork and being able to get things submitted. And you and I both know better than most, folks who are in need are not people who are apathetic or indifferent. These are individuals who just fell upon difficult times, and we owe them grace, we owe them compassion, and to be able to serve them and support them as they work towards wellness, as they work towards being able to self-actualize.
Yeah, that's so true. I often think about there, but for the grace of God go I.
Oh yeah,
right?
100%.
Because so much of homelessness is things that people didn't see coming, or they weren't prepared for, or they didn't have family or community to support to help them
100%.
through. And, you know, on one hand, it makes you grateful for what we do have,
Yeah.
but I think it also drives us
Yeah.
to do the work that we do and to try to create a more just system
100%.
and access to health care
Yeah.
for the people that they do deserve it, right?
Absolutely.
They're human beings made in the image of God.
100%.
Yeah.
Absolutely. Completely agree.
Yeah, yeah. So I'm curious, what drives you? Because I'm sensing you've just got this huge heart. What drives you in the work that you do and all the other things that you've done?
You know, I suspect it's a similar driving force, which is when you encounter not only a living God, but a loving God.
Yes.
There's something that propels you to be able to look at the world differently.
Yeah.
And, you know, I suspect similarly, you know, hardship, difficulty, life, you know, and any number of experiences. I would say in this particular work, one of the most profound experiences that I got to have and one of the greatest privileges that I ever experienced was while I was with the mayor's office. I remember getting a call from the chief of staff saying, hey, we're going to be standing up a shelter, you know, for the unhoused at the Denver Coliseum, and then at the
during COVID,
the
right?
National Western Shelter, and we didn't know what COVID was at the time,
Right.
and I had a 2-year-old, and
Wow.
I just remember I come from a military family. I remember wanting to be somebody who had a cause that was greater than myself, that I would be willing to lay my life down. And in a moment where I could look back in my own, you know, chronology of life and be able to say, in that moment where you had a chance to stand up, be counted, were you?
Yeah.
And made the choice to do so. And through being able to serve for nearly 2 years, you know, with, you know, the unhoused population, male and female, individuals within that spectrum and space, you learn so much.
Yes.
The people that you talk to, I remember talking to a gentleman who was a corporate banker who lost his job and was 1 or 2 paychecks, like most of us are, from losing his housing, and did. You know, met somebody who had wrestled with and struggled with addiction, but was on their way to recovery and getting back, and had just had a little one and was trying to find work and wanted to have, you know, more purpose because of that, more impact. Like the spectrum is very real. And when I think about, you know, human experiences, to your point, but for the grace of God, so go I, and everybody is worth love. Everybody is worth support. And when we think about service and what that is supposed to mean, if we draw a distinction around what we think is worth or not worth serving, that's a very slippery scale, because inevitably in our life we find ourselves at one spectrum or the other.
Right.
And we would hope that there would not be somebody who would judge without context, because without context it's hard to have compassion. Without compassion, it's hard to have a country, it's hard to have a nation, it's hard to have a neighbor and a community. And the hope is that through love, through compassion, through context, you're able to learn more about the person, but you're also able to learn more about yourself.
Yeah, exactly. And you know, your points are so spot on, I think, in my view. And you know, when I think about the guests that we serve, and when I think about sometimes the culture that we live in, and to your point, judgmental and condemning, and sometimes that even comes from the faith community. Yeah. And I think, unfortunately, right? And one of the things that I found myself asking people a lot lately is, if this was your brother, if this was your dad, if this was your daughter, how would you want them to be treated? Yeah. And suddenly, the people, they turn, they're, well, if it was my daughter, I would want somebody to care for her, 100%. Somebody to show her kindness. Yeah. Well, the person that we're serving is somebody's daughter. It is somebody's son. It is somebody's dad or uncle or whoever. And I think that it seems so simple to me that we just have to look at the human and suspend judgment 100%. And say, this is somebody that God loves, that God created, and just that fact alone means that they deserve dignity and our respect.
100%.
Yeah.
No, I wholeheartedly agree. Oddly enough, on the way here, was listening to the parable of the Good Samaritan. Yeah. And you have 3 groups of people who encounter, you know, this individual who, you know, fell amongst thieves. And, you know, Dr. King talks about this in one of his sermons, one of his speeches, but again, this notion of being compassionate by proxy. Yes. And you have the priests, you have the Levites, you have these individuals who, in theory, have the head knowledge and the faith foundation to want to intervene. Right. But sometimes we esteem tradition over what makes most sense in the heart of God. We esteem practices above what's practical. and we miss the heart of God.
Yes.
And what I love about the Samaritan is this notion that when you are confronted with the hardship and the pain of somebody else, and you take time to observe it, because what it talks about is the first two groups just pass by.
Yeah.
And I think that you have a lot of folks, unfortunately, particularly within, our faith community,
Right.
who it's easy to pass by.
It is.
It's easy to pass by on the way to do a religious thing at the expense of the relationship of the God that you say that you're going to worship.
Right.
And the hope is through slowing down and, again, redefining and being very sensitive and thoughtful to who our neighbor is. I was always taught that you should treat every person that you interact with as if God sent them to you on purpose.
Oh, wow. I love that.
And
That's
so
really
just
good.
this collision with calling, this collision with destiny in the form of a human person, you begin to see things differently.
Yeah.
Because if God sent somebody to you on purpose,
Right.
for purpose, then one would assume that your life is not accidental, incidental, or even your own, and therefore you're supposed to be of service because God sent this person to you. Imagine giving a recommendation and somebody goes there and it's terrible.
Right.
That's not what we want.
Yeah.
The objective is to be somebody who can be trusted, not only with the trouble of our own life, but with the trouble of somebody else's.
Yeah. I mean, right. Jesus said, to whom much is given, much is required.
Yes.
And for those of us that can pay our bills and we can, we do have health insurance. Well, Jesus's words then should compel us to say, then what am I required to do? What do I do with all this?
Absolutely.
And it certainly is providing for my family and things like that. Of course it is. But it has to go beyond that.
Yes.
Right? We have to be our brother's keeper.
Yes.
Right?
100%.
We have to.
Yeah.
Yeah. So one of the things that I really believe is that homelessness in particular is a solvable problem.
Yes.
And, one of the things I say a lot, and I've said it today a couple of times, is that I think in our country we have all the resources that we need to solve this problem.
I agree.
What we seem to lack is the collective will.
Yes.
Where the business sector, the churches, the nonprofits, the government, healthcare systems, where we all sort of come together and say, what unites us and what can we do to make the greatest impact? So from your perspective, what are some things that we can and should do as a community to rally around the solvable problem?
I 100% agree. And, I think it starts with number one, believing that it is in fact solvable.
Yeah.
Jesus talks about that the poor will be with you always. Poverty doesn't necessitate being destitute.
Right.
And so when we think about the issue of homelessness and being able to understand it, to your point, this is a P3 problem, which is it necessitates government, necessitates nonprofits, necessitates the private sector, but what it necessitates is faith that this can change.
Yeah.
And so I get to serve as a chairman of the board for the Denver Housing Authority, and one of the things that I'm excited about, and I only mention that because I'm really excited about some of these projects that we're beginning to see in our city. Yeah. Which is, when we think about homelessness, it's if we don't have a middle portion to solve and to make sure that we're helping people, then we have the extremes, which is either you can afford housing or you can't.
That's right.
And if you can't, then there's systems that are in place which on one hand support you within that context, but don't necessarily always help you get over that cliff.
Yes.
And so one of the things that I'm hopeful about is, projects where we're working on, providing housing for individuals who are a part of that middle income, household and the middle income spectrum, such that when you progress from a place where maybe you are in a really troubling and difficult time in your life, but then you find the right job. Right. You find the right community. You're making progress. You're able to make that leap because there's another rung that is within reach. Yeah. And I think that that's what it's going to necessitate is individuals through policy, through nonprofit, for-profit sectors who recognize that we collectively can solve these issues. And so I think that we have a unique ecosystem here in Denver, in particular, citing organizations like Civico, which brings together private sector and then also folks of public service into that space, because we recognize that we're the solution that we need. But the hope is folks can recognize that this is, not to your point, not only solvable, but it's inevitable in terms of us solving it because we have the right resources and the right perspective around how to coordinate said resources to do so.
Yeah, and talk a little bit about the housing space again, because one of the common denominators, I think, throughout the conversations I've had on the bench and even talking to some of my colleagues around the country has been, we need housing, we need affordable housing.
Yeah.
So if everyone or almost everyone knows that we need affordable housing, what is keeping us from providing this housing?
It's
and creating it.
It is a great question, and I think that there's a couple intersections. But when we think about affordable housing, it's recognizing the inaffordability that most people navigate and deal with. And again, I think it really comes back to, there's this old Stevie Wonder song, talks about living for the city. And, and as much as it was true then, it is such a reality now, which is the cost of living continues to skyrocket. More and more things continue to become more and more difficult to afford. And until we acknowledge that this is not, until we begin to confront this underlying meritocratic kind of approach, which is, if you work hard enough, do all of these other kind of things, that somehow you're going to be able to manage, there's a different reality. And until we acknowledge that reality, number one, policy is not going to catch up to the challenges that we're facing. Number two, you're going to have individuals who are not in touch with the reality of everybody else. And that chasm is only going to continue, to expand. So the hope is, practically, to answer your question, that through us being able to work together through different policy innovations, and then beyond that, understand that there's a reality that people are dealing with. As we acknowledge that and move into a space where we're able to ideate and innovate different ways around housing in terms of, be it better technology. We see different types of housing that is not, there's 3D printing. There's so many innovations that are taking place.
Tiny home communities.
Tiny home communities. And I also think that, when you have resources that are coordinated towards supporting, frankly, that missing middle, I think that's going to be really critical, because the production is one thing, the affordability attached to the production is the other. And I think as we have a P3 kind of focus and a connection and practical, wisdom and conventional wisdom around that, I think that we're going to be able to see not only affordability, but sustainability, because it costs, people don't understand the amount of costs that your local government, your state government, your federal government incur because we're not solving these issues. So it's grossly inefficient.
And if we could turn that corner and say, if we do these things, it will actually, it makes financial sense down the road to spend that money
100%.
now. But yet that's such a hard corner for some people to turn.
Yep. It is.
I know I'm not telling you anything you don't know.
Oh, man. It is a hard corner, but to your point, I am also hopeful that through storytelling, through enough people being able to see the reality of the issue, I think that by and large, I think deep, inscribed in the tablets of the hearts of individuals and people are the laws of God, which is to say that the love of God is in there. The challenge that we have is, there's nothing more tragic in my view than when you are blessed at a certain point, that somehow amnesia creeps into your mind. That somehow your context becomes the framework for everybody else, not recognizing that if it wasn't for that person who gave you that first job, if it wasn't for that person who loaned you money when you didn't have it, if you don't look back at your own life and excavate it for the grace of God and the compassion of God that he visited upon you, that kind of forgetfulness becomes scaled. And the unfortunate thing is, you being entrusted with great resources makes you feel like everybody else can, and that it's not your duty to. And the unfortunate thing is, a lot of people forget that reality, unfortunately. And, my hope and prayer genuinely is loving your neighbor takes on a different form, because loving your neighbor now through privilege and through resources and any number of things that all of us benefit from, that neighbor looks entirely too much like you. And God wants us to love somebody who looks like us and doesn't look like us, because that's complete love.
Well, and you referenced earlier the Good Samaritan story, and one aspect of the Good Samaritan story is the Samaritan, that helped the person that was beaten. They could not have been more different. The religions were different.
100%.
The race, everything
Culture,
was
everything,
different. And what is Jesus doing when he's telling us that story? He's like, you might think I'm saying just, help your people. I'm saying everyone is your neighbor.
100%.
And
Absolutely.
And it's that kind of message that I think we need to keep taking into this community and
100%.
going, no, everyone is our neighbor.
Absolutely.
Everyone.
Completely agree.
One of the things we do around here, and we just had a all staff meeting a couple of months ago, and we usually try and get another T-shirt or something. And the T-shirt this year, the back of it is a lot of our staff are wearing them tonight, but it says, Jesus said, feed the poor, give clothes to those that are in need, welcome in the stranger, care for the sick. And and that's how we do our work here, because the thing to know about what Jesus told us is he didn't qualify it.
No.
He didn't say, feed only the hungry who look like you, vote like you, act like you, worship like you.
Correct.
He's like, if somebody's hungry, period, feed them.
Correct.
That's what I'm calling you to do.
Yeah.
And if you don't do it, you're saying no to me.
100%.
Right? I don't want to say no to Jesus.
Exactly. No, I don't. And to your point, he not only ups the ante, he says, he continues in another passage and says, if you think that you have love, but if you love people who love you, aren't others like that? Aren't the plebeians like? In other words, you're not special for loving people who love you.
Yes.
There's something.
Anybody can do that.
There's the transcendent love of God is loving somebody who's not like you.
Yes.
And that's when we begin to step into that agape space that creates transformation, that creates movements, that creates unity, that creates healing. And our nation, our country, our state, our world is in need of that kind of healing. And with the work that you all are doing, with the folks in the communities that we get to serve and the people that we get to love on every single day, those are the pockets of hope that I hope people will lean into, because whether you're unhoused or you're housed, whether you're somebody who's never taken a sip of alcohol or somebody who's been addicted, everybody is worthy of that kind of unconditional love. And what a gift it is that we are afforded the opportunity to walk in that kind of love every single day.
Yes, I couldn't agree more. Well, believe it or not, I mentioned that this time was going to go really fast, and it's gone really fast. But I'm just so grateful that you would come out this late at night and sit on a bench, and it's been so amazing to meet you. And I just personally hope that this conversation is one of many that we have, and finding ways to work together and things like that. But so grateful for you and for your heart for God and heart for the people that we're all trying to serve.
Same. God bless you, and thank you for the work that you and your staff do every single day. You all are absolutely inspiring, and looking forward to many more conversations.
Absolutely. All right. Thank you so much. All right. So that is our last live interview for tonight until early tomorrow morning. So we're going to play some taped content throughout the next couple of hours, because I'm old and I need to take a couple of hours to nap. So just thank you again. And we are so excited that people are joining Conversations on a Bench.